And hello, my friends. I'm Dr. Sophia, a urologist and men's health specialist with 5 years of hands-on experience helping guys just like you. Today, and I want to talk about something personal that many older men deal with quietly, your private time alone. If you're over 60 and still enjoying those solo moments, and that's completely normal and can even be a positive part of life. But here's the thing, the way it's often handled might be sneaking up on you and making things like staying firm, feeling every sensation, or even keeping your spark with a partner a bit tougher than it needs to be. And it's not about stopping or feeling bad. It's about doing it smarter to keep your energy high and your body strong. I've seen so many men in my clinic turn this around and regaining that confidence and closeness they thought was fading away. Stick with me because I'm going to share real insights that could change how you feel every day. And let me paint a picture for you. Imagine waking up feeling more alive with better blood flow where it counts, sharper senses, and a renewed sense of connection, not just physically, but in your relationships too. That's what happens when we address these hidden habits thoughtfully. And in my years working with men in their 60s, 70s, and beyond, I've learned that small adjustments can make a huge difference. And we're talking about turning a routine that might be draining you into one that builds you up. And don't worry, this isn't about complicated medical stuff or judgments. And it's straightforward, backed by what we know from studies on how the body ages and focused on practical steps anyone can take. Before we jump in, and if you're finding this helpful, go ahead and subscribe to my channel and hit that notification bell. That way, and you'll catch all my tips tailored for mature men looking to stay vital. Also, and drop a comment letting me know where you're tuning in from. I'd love to connect and hear your stories. Now, let's get into the heart of it. And most guys assume their alone time is either all good or something to avoid altogether, but the reality is somewhere in the middle. When approached with care, and it can support your overall well, being like keeping things moving down there to help your prostate stay healthy, improving circulation throughout your system, and even giving your natural hormone levels a gentle nudge in the right direction. But if it's rushed or repetitive without variety, and it can lead to subtle issues that build up over time, affecting not just your physical side, but your mood and relationships too. Today, and I'll walk you through 10 under the radar challenges that can come from this habit in later years. The ones that don't get much airtime, but show up in my office all the time. And more crucially, for each one, I'll give you easy fixes based on what works for my patients. And to wrap it up, and I'll introduce a quick 7-second daily move that's helped hundreds of men boost their firmness, drive, and self-assurance without any pills or fuss. And this is all about empowerment, understanding your body's signals, and honoring the incredible resilience you still have. First off, and let's talk about how this can sometimes pull you away from real life connections. I remember a 68-year-old gentleman, a former mechanic, and who shared with me that he hadn't hugged anyone in weeks, yet he was handling things on his own regularly. Is that a problem? Well, not the act itself, but when it becomes a substitute for human touch, it can quietly lead to feeling more alone. And human contact isn't just nice. It's essential for keeping your bodies feel, good chemicals balanced, maintaining healthy levels of that key male hormone, and in supporting your emotional health. Studies show that regular social interactions help keep stress low and energy up. So if your solo routine is your main outlet, and try mixing in some simple outreach, call an old buddy, join a local walking group, or chat with someone at the coffee shop. And these small steps can reignite that sense of belonging and make your private moments feel like a bonus, not a replacement. Moving on to something more physical as we age, and the skin in sensitive areas gets a bit more delicate, like fine paper instead of tough leather. And rough handling or going without enough slip can cause tiny irritations or small breaks in the surface. And one patient in his mid-70s came in complaining of ongoing discomfort, and it turned out his fast-paced approach was the culprit. And these little issues can lead to swelling, reduced feeling, or even invite minor infections if not addressed. The good news, it's easy to prevent. Opt for a gentle touch, and add a water-based lubricant to reduce friction. Think of it like oiling a hinge to keep it smooth, and take your time. Research from urology journals backs this up, and slower mindful practices help maintain tissue health and preserve sensitivity over the years. Another common one is when things start feeling numb or less exciting, and especially with a partner. Guys tell me all the time, it works fine by myself, but not so much when we're together. This happens because repeating the same motions or thoughts trains your nerves and brain to expect only that exact setup. Over time, and it can dull responses to anything different. But your body is adaptable. Science on neuroplasticity, or how the brain rewires itself, shows we can retrain it. And the key is variety. Switch up your hand positions, try different speeds, or let your mind wander to new scenarios. Give it a few weeks, and many men notice sensations sharpening up again, making intimacy more enjoyable all around. Sometimes this habit can cover up bigger concerns without you realizing it. And a man might think everything's okay because he can still respond solo, but struggles in shared moments point to possible underlying shifts, like changes in blood vessels and hormone dips or nerve signals. Ignoring it can let things progress, but catching it early often means simple lifestyle tweaks can turn it around. And I always advise getting a check-up if this rings true. Blood tests or a quick exam can pinpoint issues, and options like better sleep or exercise often do the trick without jumping to meds. Posture plays a role too, believe it or not. And if you're slouched in a chair or tense during these times, it can put pressure on nerves in the lower body, leading to tingling or loss of feeling. An older client and a retired accountant was dealing with numbness until we realized his seating habits were compressing key pathways. To fix this, get comfortable, lie down, and prop up your back and incorporate stretches for your hips and spine. Keeping good alignment supports nerve function, as confirmed by studies on pelvic health, and ensuring long-term comfort and responsiveness. On the emotional side, relying solely on this for stress relief can turn it into a go to escape from life's ups and downs. And it's great for a quick mood lift, releasing those natural happy chemicals. But if it's your only tool, and it might keep you from facing feelings head on or seeking out other joys. Expand your options, walk in nature, pick up a hobby like gardening, or talk things out with a trusted friend. Building a fuller life toolkit, supported by mental health research, helps balance everything and keeps your energy steady. And guilt can sneak in too, often from old messages we've carried for decades about what's proper. This inner conflict raises stress hormones, and which can interfere with relaxation and enjoyment. But let's flip that script. Treating yourself kindly is a form of self-respect, especially as we age. And compassionate self-talk, perhaps with journaling or chatting with a counselor, can dissolve that shame. And evidence from psychology shows rewriting these stories leads to better overall well-being and more fulfilling experiences. And frequent sessions without breaks can also lead to a buildup of pressure in the lower abdomen, causing a nagging HE. And this is your body's way of saying it needs a rest to recover. One patient described it as a constant heaviness until he spaced things out. And listening to these signals, aim for moderation, like every other day, and allowing downtime helps tissues rebound. And urology experts note that this approach maintains better flow and reduces discomfort. If family planning is still on your mind, and daily routines might thin out the quality of your output temporarily, for those trying to start or add to a family, and giving it a few days between can concentrate things better. Even if that's not your goal, this moderation preserves your vitality, as fertility studies suggest. Lastly, and getting too wrapped up in fantasies or screens can make real-world connections feel less thrilling. The brain gets used to high-intensity inputs, but it's flexible. Taking pauses and focusing on genuine touch or memories can recalibrate it. And research on brain adaptability confirms that stepping back reignites natural desires. Now, for that promised routine, find a comfy spot to lie or sit back and breathe deeply from your belly for a few seconds. Then gently tighten the muscles you use to stop urine flow. Hold for 7 seconds, release slowly. And do this 5 to 10 times daily. It strengthens support structures, boosts circulation, and calms your system, all backed by pelvic floor therapy studies. And to enhance all this, let's touch on some everyday habits from a urologist's view. Eating well plays a big part in supporting your vitality. And focus on foods rich in nutrients that aid blood flow and hormone balance, like leafy greens, nuts, berries, and fatty fish. And these provide antioxidants and healthy fats that can keep vessels flexible and energy up. Avoid too much processed stuff or sugar, which can drag you down. And pair this with staying hydrated. Aim for plenty of water to keep everything running smoothly, and light exercise like daily walks to promote circulation. And if you're dealing with any ongoing issues, consider zinc-rich foods like oysters or pumpkin seeds, as low levels can affect drive, per nutritional research. And expanding on these ideas, think about how your daily routine ties into this. Sleep is huge. Aim for 7 to 8 hours to let your body repair and hormones reset. And stress management through simple breathing or meditation can lower those interfering chemicals. And don't overlook check-ups. Regular visits catch shifts early. And one story that sticks with me is a 72-year-old widower who felt disconnected until he made these changes. By varying his approach, adding social time, and doing the routine, and he reported feeling more present and energetic. It's proof that small shifts compound. Remember, this isn't about perfection. It's about tuning in to what your body needs. And if something feels off, talk to a doctor. Early action often means easier solutions. As we wrap up, know that your age doesn't define your potential. With mindful habits, and you can fuel a life full of confidence and joy. If this resonates like the video, share your first step in the comments and subscribe for more. And you've got the tools. Start using them today. Diving deeper into the first challenge, social withdrawal, it's fascinating how our bodies crave interaction. And touch releases oxytocin, that bonding chemical which helps regulate mood and even supports heart health. Without it, levels dip and potentially leading to blue feelings or lower motivation. But rebuilding is straightforward. Volunteer at a community center or join a book club. And these foster bonds that enhance everything else. For skin care down there, think of it like protecting your hands from chapping in winter. And gentle products without harsh chemicals prevent issues, and allowing healing time between sessions lets tissues strengthen. And patients who've switched to this report less irritation and more enjoyment. On desensitization, varying stimuli keeps neural pathways active. And try incorporating feathers or soft fabrics for new sensations. It's like cross-training for your senses. Over time, this broadens responsiveness and making shared moments more vibrant, masking deeper problems. Absolutely, it's a red flag. Vascular health ties to diet. Add tomatoes and watermelon for lycopene, and which supports blood vessel function. Combined with the routine, it amplifies benefits. Poor posture affects more than just this. It can lead to back pain too. And yoga poses like child's pose open up the area, improving nerve flow. Incorporate them weekly for sustained relief, emotional reliance. And diversify with journaling to process feelings or mindfulness apps for calm. This builds resilience, reducing the need for quick fixes. And shame's impact is real. Chronic stress from it can affect sleep and appetite. Affirmations like, I deserve comfort, shift mindsets, and supported by cognitive therapy principles. For pelvic buildup, hydration flushes systems, and warm baths relax muscles. Listen to cues your body knows best, semen quality. And even post-family, moderation keeps things optimal for health. Add Brazil nuts for selenium, aiding production. fantasy overload. And ground yourself with nature walks to reset dopamine responses. Real connections then shine brighter. Expanding the routine, do it morning and night for consistency. And track progress in a notebook. Many see changes in weeks. Diet-wise, a Mediterranean-style olives, veggies, whole grains bolsters urologic health. And studies link it to better